Hello, everyone. My name is Megan Glenn. I'm the National Assistant Director of Programs at the American Liver Foundation, and I would like to welcome you to today's webinar, made possible by the generous support of Bristol Myers Squibb and CIMABay. The American Liver Foundation is the nation's largest nonprofit serving people with liver disease. We provide a voice for patients with liver disease and their families through education, support, research, and advocacy.
Okay,
I would like to thank Dr. Sujit J, who will be sharing his expertise on today's webinar, and Jess Schnur, who will be sharing her experience participating in a clinical trial. Let me just start with a few housekeeping items. On the upper right-hand part of the screen, you should see a dialog box. If you don't see it, there's an orange arrow you can use to expand the window. From here, you can ask questions. You can ask questions at any time, and we will be answering them at the last 10 to 15 minutes of the webinar. We will get as many questions answered as possible, so we welcome your participation, and please do send questions in. I would now like to introduce Dr. Sujit J. Dr. J. attended medical school at the University of Chicago, where he also completed a PhD in immunology as part of the medical scientist training program. He completed his residency in internal medicine and a fellowship in gastroenterology as part of the physician scientist development program at the University of Chicago Medical Center, and is board certified in both of these disciplines. He has also earned board certification in obesity medicine. Dr. Janardhan's clinical focus is the care of patients with chronic liver disease, with a specialization in management of patients with non-alcoholic fatty liver disease. He is the director of Weight Intervention and Liver Disease Clinical Pathway, a comprehensive weight loss program housed within the Rush University Hepatology Clinic, and co-founder of the Rush University Metabolic Health Program. He is principal investigator on several clinical trials related to the treatment of various chronic liver diseases, and is a member of the American Liver Foundation's Great Lakes Division's Medical Advisory Committee. Dr. Janardhan, I will give you the floor.
Okay, great. Can you guys all hear me okay?
Yes, you can go ahead.
Oh, you can. Okay, I just wanted to make sure I'm messing around with this, with how I'm talking to you guys, and I think it just made it worse. So I went back to what we were doing originally. Okay. I just guess, oh, there we go. Now I got control. So let's move on. So, well, thank you so much, the American Liver Foundation, and everyone that's participated in this webinar today. I'm really excited to talk to you guys about clinical trials and clinical studies. As long as I can get this to click forward. There we go. So I would like to cover a couple of different topics today. One, we talk about clinical studies, and that really encompasses two big groups of studies. There's observational studies, where we are just looking at the way that people behave and the way that their disease course progresses when they're getting their routine medical care. And then there's clinical trials, where we're really studying the effect of an intervention, a new intervention on patients. I want to talk to you about why clinical trials have phases. They have multiple phases, going from phase 1, 2, 3, and 4, and I want you to understand why it's important to have all those different phases. We'll talk about the potential benefits and risks of participating in a clinical trial. If anyone that's considering that, I think it's an important thing to think about. But I also want you to have a sense of what's it going to be like to be in a clinical trial. So we'll talk about some of the logistic factors that clinical trial staff have to think about before inviting a person to join a clinical trial. We also talk about what a person themselves, a patient, should think about before joining a clinical trial. And ultimately, I want you guys to be prepared. If you ever get into a position in your life where you or a family member is considering a clinical trial, I want you to know the questions to ask. And then more importantly, I want you to know how to be able to find those clinical trials if you are interested in them. Oops, that went twice. Okay, so first let's talk about the phases of clinical trials. Oh, actually, this went 2 clicks. All right, so we'll talk about first about clinical studies. So like I alluded to, clinical studies, there's two main groups. There's observational studies. Now, the big thing that it's important to remember here, for an observational study, people who are participating in the study are getting routine medical care. There's not a specific intervention that's prescribed by the study or by the investigator. What we generally do is group patients by certain sets of characteristics. So we may take all the patients that have a disease versus a comparator group that does not have the disease. And that's what we call a case control study. And then we may look at, hey, what are the outcomes for people who have the disease versus people that don't have the disease? Alternatively, there's a study type called a cohort study, where we take all the people who have a disease and we break them down by, hey, what the group of people that have the disease that got a medication versus the group of people that didn't get a medication. Again, it's not an intervention. That medication was not assigned by the study team. That medication was just given as part of their routine medical care, and we're studying and observing what the effect of that intervention was. But again, it's not, the intervention was not assigned by the study. Again, for both situations, we are looking at patients' health outcomes, but the big difference here is that this is people's routine medical care, and the study itself does not assign an intervention. So an example of that would be looking at all patients who have cirrhosis. So this would be a cohort analysis. People who have cirrhosis, and we'll break them into people who have been prescribed a cholesterol-lowering agent versus those who have not been assigned a cholesterol-lowering agent. And then we say, hey, do the people who get the cholesterol-lowering agent have more or less complications of cirrhosis? There was a big study in the VA that showed that people who take cholesterol-lowering agents who have cirrhosis have less complications. So that's an example of a real-world observational study. Now, in contrast to that are clinical trials. And in this, the big difference here is that this is not routine medical care. This is a specific intervention that is being provided by and assigned to participants as part of a clinical trial. Jumping down to the last point, it's important that what we're studying here is usually a new intervention, or it's a new use of an existing intervention. And when I talk about interventions, I'm using that word rather than a medication, because a clinical trial can be a medication, like a new pill or new therapy, or it could be a surgical intervention. So it could be, for example, trying a new surgical technique for liver transplants, or it could be a behavioral intervention, such as participation in a weight loss program for patients with non-alcoholic fatty liver disease. So it's important that we just talk about it as an intervention, but it really could be any type of intervention. But the point is, it's a new intervention, it's one that hasn't been used before, or it's a new use of an existing intervention. So you may take a medication that is approved for another disease, and now we're studying it in a new disease. So it can be a new use of an existing intervention. So the other big thing that we see with clinical trials is this concept of a placebo. So in order to know that an intervention works, we have to compare people who got the intervention to people who did not get the intervention. And it's important that those two groups of people be relatively similar. We want them to have the same diseases. We want the same distribution of men versus women. We want them to be roughly equally as sick with whatever disease we're treating. And that's the only way that we can get a sense of, hey, if everything else is the same, does getting this intervention actually affect the disease? So when we talk about clinical trials, we talk more about randomized controlled clinical trials. The randomized component of it means that you are randomly assigned either to get the intervention or to get no intervention at all. And if you got no intervention, you'd be considered part of the placebo group. And the ability to put people either to an intervention or a placebo is how the study is, quote unquote, controlled. That's how we know that the only difference between these two groups of people or these two groups of patients is that one received the intervention and one didn't. But that's a big concern for a lot of patients that are getting into a clinical trial. A lot of them are scared that, oh, what if I get the placebo and don't even get the medication in the study? So an example of a clinical trial would be does the use of obeticholic acid reverse the progression of non-alcoholic fatty liver disease compared to placebo? So that's a trial that's actually ongoing right now. And obeticholic acid is a medication that's FDA approved for another liver disease, primary biliary cholangitis, but it's a new intervention for non-alcoholic fatty liver disease. And that is currently a phase 3 trial, just so that you guys get a sense of, these are real world things that do exist. Okay, so moving on now to the next question, which is, sorry, it's a little tricky, I'm sorry. Okay, so the phases of clinical trials. So there are 4 different phases of clinical trials, and basically, as you go through the phases, you end up with more patients, and you learn more about the effectiveness of that medication. So phase 1 is usually just a very small trial, usually less than 100 people, and usually this trial is done in a small group of healthy patients. It's not the group of patients that this intervention is studying to treat. So usually they're just plain old healthy patients. And the point of this phase is to understand how safe is this medication and what are the side effects. And we want to isolate the idea that, oh, it might just be side effects related to the disease it's trying to treat. So that's why it's done in otherwise healthy patients. The other purpose of this phase is to find the correct dose of this medicine. So what is the dose of this medication that allows reasonable blood levels to exist? So very often when you participate in a trial like this, you'll be getting blood draws very frequently to understand how taking the medicine affects the blood levels of it. So that's a phase 1 trial, very small, but we're not really studying the effectiveness of the medication. Okay, we're studying the safety and the side effects. In phase 2, we start to focus on how effective is the intervention. So it's usually a bigger group of people, 100 to 300 people, and in this case, they usually have whatever condition or disease the intervention is meant to treat or affect. So it could be, if it's a study of a medication for heart disease, this will all be patients that have heart disease. And again, we will always be looking at what is the safety of the medication, what are the side effects of the medication, but the real focus here is to get some preliminary data to say, hey, does this medication affect the disease? Is it an effective medication? Now, again, we can't definitively prove that it's effective because it's a small group of people, but it's just to get that preliminary sense of, hey, is there a signal there? Is there a sign that this medication might be able to help people? Phase 2 trials can last several years. They're usually not that long, not as long as a phase 3 trial, but they can last quite a while. Now, phase 3 is really where you're making that final decision of, is this medication effective or is it not effective? You're studying it in a large group of people, 300 to up to 3,000 people, and it's all people who have the particular disease that they're studying. Of course, you have ongoing safety analysis, ongoing safety side effect analysis, but you're really trying to get a sense of, hey, just how effective is this medication? And you may be studying, because there's so many people in the trial, you may be studying specific subgroups. So you may study this medication in different races. You may study different doses of this medicine. So is there a benefit to the higher dose, or is it just as effective at the lower dose? And then these are real people. So you're studying the effects of other medications. So if a person's on a cholesterol medication, does it affect this medication? Ultimately, the group is heterogeneous enough that the FDA feels that if you've successfully completed a phase 3 trial and we've shown that your medication is safe, it's effective, and the side effects are tolerable, very often the FDA will approve that medication for use in the general public with the disease. Now, again, it still may be restricted. You may only be able to give that medication to the people who meet the criteria that was used in the phase 3 trial. It's not like everyone could get the medication, but that's where it goes into the general public. The next phase is also equally important. That's the phase 4 phase. And what we're looking at here is this occurs after FDA approval, and we're really trying to understand what happens to this medication when it goes into the real world. When it's not in a very controlled clinical trial where everyone's being monitored every month, how safe is the medication? What are the side effects when the general public gets a hold of this medication? And is it still effective? If there was a minor difference between the placebo group and the intervention group in the phase 3 trial, do we still see that benefit in the general public? Okay, so now we ask the question of, should I be in a clinical trial or not? And ultimately, this is a personal decision. There are risks and benefits, but it's something that you absolutely should talk about with your physician. It's something you absolutely should talk about with your family. It's absolutely something you should talk about with the clinical trial staff. But really, it's a personal decision. But there are some general risks and benefits that we think about. So starting first with the risks. Ultimately, you have no idea whether this medication is effective or safe. Now, we know even less about the medicine at the early phases. So for example, if you're talking about a medication in a phase 3 trial, you at least have the preliminary data from the phase 2 trial to know, hey, in this small group of people, it did show some benefit. And generally, if a medication didn't show any benefit in phase 2, it doesn't even become a phase 3 trial. But really, you need to, you can't, no investigator can ever say that this medication is effective until they've completed their phase 3 trial and even their phase 4 trial. So it's important to know that no matter what you hear about a medication or an intervention, you will not ultimately know their effectiveness, but you can feel a little bit more confident if you're talking about a later stage trial. The other big risk of the trial is that these clinical trials are very often a big time commitment. You have to come to visits frequently, just for routine monitoring, and if you have side effects, you may even have to come to more clinical visits. And usually the time commitment is more intense in the later phase clinical trials, not just because of how frequently you're coming, but for how long the trial. Very often these clinical trials last 3-5 years sometimes. The other risk of being a part of a clinical trial is sometimes you have to undergo invasive testing. Now, sometimes that just means blood draws, frequent blood draws, but in the case of many liver disease trials, it involves liver biopsies. And liver biopsies have a low but measurable risk associated with them. And even the screening testing, you may have to undergo an endoscopy, you may have to undergo a colonoscopy. So very often there's invasive testing that can be associated with clinical trials. So it's important that you understand the risks associated not just with the clinical trial itself, but with the testing associated with the clinical trial. And one other risk is obviously what we talked about before, that you might not get the study drug. You may come to all the clinic appointments, all the research appointments. You may be willing to accept the fact that that there may be side effects of the medication, but after all of those things, you might get the sugar pill. So you might not get the medication. But it's not all bad. There are some benefits to clinical trials as well. You potentially get access to a medication or treatment before the general public. So if you have a disease, especially a disease that's advanced, and you want to do anything you can to help that disease get better or at least stay stable, then this may be something that is available to you as a treatment before it's available to the general public. And this is, particularly poignant for people who have a disease where there is no medication or treatment currently available. The other thing is more of an altruistic component. You are looking to see, your participation in a clinical trial is how you can contribute to help other people with your disease, and just to help the medical community help treat your disease and understand your disease better. If we never got anybody to participate in clinical trials, we would never have new medications for any disease. So there is an altruistic aspect to participating in a clinical trial. As I alluded to before, sometimes people participate in clinical trials because they want to do everything possible to help themselves get better. Finally, I put placebo in a benefit group as well, because there's this concept called the placebo effect. And nobody fully understands exactly why it happens. But we see that sometimes when a person is part of a clinical trial, their disease improves even if they don't get the intervention of that trial. We think that part of it is just the mental aspects of being part of a clinical trial. You can imagine that if you had non-alcoholic fatty liver disease and you were part of a clinical trial and you had to go every month to a research appointment, non-alcoholic fatty liver disease is going to weigh on your brain a lot more heavily than if you were not part of that clinical trial. So maybe all the other advice that you're getting in terms of lifestyle changes, weight loss, dietary changes, maybe they're weighing a little bit more on your head. And because of that, you're paying more attention to the disease and you're doing more of those interventions. And so you're just getting better, even though you're not getting the intervention. Again, there's no way to know exactly how placebo effect occurs, but it's a very well-known effect that just being part of a clinical trial can sometimes improve outcomes for patients. So again, should I be in a clinical trial? There's the risks, there's the benefits, but there's also the considerations. And these are the considerations that people should think about before they participate in a clinical trial. One big thing is that people who are running clinical trials do not like people to drop out of them. Of course, the primary focus is always the safety of our trial participants, but we want to make sure that we don't set people up for failure. We don't set them up in a way that they're probably going to drop out of the clinical trial. We want to know that the people that are committing to a clinical trial are in fact committed to it, and they're going to continue to be able to be a participant obviously barring severe side effects or some complication. So one of the questions we ask people is about the stability of their life plans. For example, are you planning on moving in a year and the trial that you're involved in is a five-year trial? Are you planning on having a child? Very often clinical trials are, they exclude people who are pregnant or are planning on getting pregnant because again, you don't know what the medication is going to do to an infant or a baby. So that's something that we want to think about. If we put someone in a 5-year clinical trial, we want to make sure that they're not planning on having a baby over the next 5 years. And that sometimes is a commitment that people are not willing to make. The other thing is, are you willing to accept some side effects? So it's a new medication, there may be side effects, and we want people to be aware of the fact that there may be minor side effects. We, of course, if a person has severe side effects, want to make sure that they're taken care of, and if need be, we stop the medication, we remove them from the clinical trial. But we also want to know, are there mild side effects associated with this drug? When we give this in the general public, should we expect people to maybe have a little bit of itching or a little bit of light sensitivity? So are you willing to accept minor side effects? Now, that being said, I want to make sure it's very clear to everybody that there is layer after layer after layer of protection when it comes to a clinical trial to ensure that we do not have people get hurt by these medications. The earliest side effects, there's a protocol in place that goes all the way from the FDA to the pharmaceutical company that's giving the medication, to the principal investigator, to the research staff, to make sure that those side effects are very closely monitored, and that we make sure that we're not hurting people. And that if there's any signs that we are hurting people with a certain medication, that we stop that medication in that person. And in fact, from a large group, the FDA and the companies that run these clinical trials, they keep track of all the side effects for all the participants in the trial. And if there's ever a clear sign that, hey, these medications are dangerous, the trial is ended. So I want to make sure that people know that, but still, it's important that we tell people about expected side effects and that they would be potentially willing to accept them as long as they weren't too severe. Finally, are you willing to undergo those invasive tests, right? Are you willing to undergo multiple liver biopsies or a colonoscopy and all the other things that are involved in the trial? The nice thing about that is you know about it before you get involved in the trial. Finally, are you willing to give the time commitment? Are you willing to come to all the clinic appointments? If you have side effects, are you willing to come to extra appointments? It's not really an option to be late, meaning when we need to see patients at 1 month intervals, it needs to be almost exactly 1 month. So there's a lot less flexibility compared to just a routine clinical visit for your regular doctor. The other thing that you should think about is that if you participate in this clinical trial, it may prevent you from participating in a future clinical trial. Very often when we set up a clinical trial, we exclude patients who've been part of previous clinical trials because of the fact that we don't know what the long-term effect of the previous clinical trial intervention is. And so we don't want to cloud the data for the new intervention. So it's important that you, first of all, say, hey, what is known about the intervention I'm receiving for this? Is it known to be effective in terms of preliminary data? And also, what other trials are available at your institution? Is this the best fit for me, or should I maybe be considering another clinical trial? And then ultimately, would you be willing to accept the consequences? And this is a little bit more of a complicated question. If you did participate in the clinical trial, you have to be able to accept the consequence that, hey, I participated in the clinical trial and the intervention just did not work. Maybe you got the placebo, or maybe you actually got the intervention and didn't work and your disease worsened. So you have to accept the fact that these are all experimental medicines and we don't know for sure whether they're going to work or not. So it's a bit of a shot in the dark. So you have to be able to know and be willing to accept that. But you also have to be willing to accept the converse of that. If you did not participate in the clinical trial and you did not get access to a medication that potentially was beneficial in your disease and your disease worsened, is that something that you'd be okay with? Could you sleep at night knowing those things? And I think it's important that you consider both sides of that coin. Moving on, so what exactly should you expect if you're getting to be part of a clinical trial? So initially, you're probably going to discuss participation in a clinical trial either with your doctor or with one of the research coordinators that your doctor works with or refers you to. You know, it's very reasonable to ask your doctor about what they think about the clinical trial. And they may say, you know, I don't know that much about it, but I think it's important that you go and learn about it. You know, then the research coordinators or potentially the principal investigator for the trial, who's usually a physician, can tell you as much as you want to know about it. If you agree to proceed, they'll have you sign a consent form that says that, hey, I want to participate in this trial. I want to see if I'm eligible for this trial. I didn't put that as one of the things, but they will give you a lengthy consent document. It's called the informed consent, where they tell you, what is this study for? You know, what is the potential testing associated with it? What are the risks and benefits, etc. And they'll walk you through all of those things. And it's only after you say, okay, after getting that information, I am now providing my informed consent that says that I want to participate. After you do that, you start undergoing screening for the clinical trial. So that's basically just a bunch of testing. It could be lab work, it could be liver biopsies, it could be endoscopies, it could be anything in order to see, are you eligible for the clinical trial? Now, very often this is time sensitive. It needs to be all done within a certain time period. So it might be lots of tests that are all booked together. Again, getting to the idea of you have to be willing to undergo the time commitment. Now, those screening tests are ultimately to determine, do you meet the inclusion or exclusion criteria? So inclusion criteria are things that you must have in order to be part of a clinical trial. So if this is a clinical trial for, let's say, non-alcoholic fatty liver disease, the inclusion criteria may be something to the effect of, you are between age 18 and age 65. You have a biopsy-proven non-alcoholic fatty liver disease. You do not have severe heart, so the continue on the inclusion criteria, you would say you have non-alcoholic fatty liver disease proven by a biopsy. You have at least stage 2 scarring with your non-alcoholic fatty liver disease, and other things that you just need to have in order to be part of the clinical trial. The other side of that is the exclusion criteria. So in that case, these are things that you absolutely cannot have to be part of the clinical trial. So it may exclude people, let's say, who have bad heart disease. So if you have heart disease, you cannot be part of this clinical trial. If you have kidney disease, you cannot be part of this clinical trial. If you have certain lab abnormalities, for example, your blood protein levels are too low or too high, you cannot be part of this clinical trial. And so basically, if you meet all the inclusion criteria, so basically you have all the things that you have to have, and you do not have any of the exclusion criteria, the things that you cannot have, then you can be a part of this clinical trial. Now, after people go through all of this testing, they often get very frustrated because either they don't have one of the inclusion criteria or they do have one of the exclusion criteria. And they say, it's not fair. I have this disease. I want to be a part of this clinical trial. I deserve to be a part of this clinical trial. My disease is going to get worse if I can't get this medication. It's really important to understand that not being eligible for a trial does not mean that you are not deserving for that medication, okay? The people that build these clinical trials have to know if these medications work, right? They have to know if the intervention works. And they have to do that in a very, very strict, well-defined population. If there's a lot of heterogeneity, if there's a lot of variability between the different groups, it's very difficult to make an informed conclusion about whatever the intervention is. I have one patient that was excluded from a clinical trial just because their lab value was 0.01 past where it needed to be. And on recheck, it was 0.02. So it's arbitrary, but it's important that we be very clear that just because you can't be a part of a clinical trial doesn't mean you don't deserve that medication or that intervention. It's just that in this context, you can't be a part of the clinical trial. Okay, so after that, if you meet the inclusion and exclusion criteria, you then undergo something called randomization. And that's where people determine whether you're going to get the intervention, and if you are, which dose of the intervention you're going to get, and then which group is going to get the placebo or not get the intervention. Once you're randomized, you would either start on the intervention, so maybe start a medication or a placebo, and then you get frequent study visits where they check your labs, they check in to make sure, are you having side effects? But importantly, you will also have a phone number to call of a research coordinator or the principal investigator for you to call when you have side effects. So if you suddenly between study visits develop abdominal pain or vision changes or any other abnormal side effect, we want to know. It's important that if you're part of a clinical trial, you have that person's number on speed dial, and if there's anything going on, you should be calling them right away, because again, these are experimental medications and we don't want people to get hurt. Moving on, what are the questions you want to ask your research team? So I think it's a fair question, especially for your physician or the research team. Why are you considering me for this trial? How come you're considering me and not the patient, down the hall? What is it about me that makes you think I would be a good fit? Is it because my disease is really advanced? Is it because I uniquely fit the criteria for this study? Or is it just because you're putting everybody in this study? So I guess, it's an important thing that you understand why they're approaching you about the study. And then what happens if I do participate? What happens if I don't participate? If I do participate, what happens to my routine clinical care with my doctor? Do I stop seeing that doctor? Usually the answer is no. You'll usually continue to get your routine clinical care. But there may be restrictions on certain medications you can take to remain part of the clinical trial. And what happens if I don't participate? Am I going to be thought of badly? Am I not going to get treatment? And the answer is always no for that. Usually if you do not participate in a trial, you continue seeing your doctor the way you always would have, and they do not change a single thing. But it's important to ask that question. And then, is there preliminary data about these medications? So what's known about the efficacy? And again, it's really important that you not get some cryptic information. You have every right to ask the study staff, can you give me this preliminary data in a way that I can actually understand? A lot of people will give you a clinical trial from a phase 2 study that you can't read at all. If they want you to be part of their clinical trial, they should be able to give you that information in a way that you can understand, and I don't think that's unreasonable to request. Ask them about potential or expected side effects of the intervention being studied, and get a full understanding of what is the time commitment. What type of testing do I have to do before the trial? What type of testing will I have to do during the trial? And how invasive is that testing? And then finally, it's very reasonable to ask, hey, what other trials are available at your institution or other institutions around this area? If a institution only has one available trial, then of course they're going to try and recruit people into that trial. But it's fair for you to ask, are there other trials at other institutions that might be a better fit for me? And that's part of also doing your homework about clinical trials. And this is a question that I always tell my patients, including the ones that are not my personal patients but have been referred to me for a clinical trial, is I tell them, if you were my friend or you were my family member, I would or I would not recommend this clinical trial to you. So I think it's very fair for you to ask clinical trial staff and the principal investigators and your physician, would you tell a family member to be a part of this trial? Do you think that the preliminary data is good enough that you would recommend family or friends to be a part of this clinical trial if they were in my position? And then again, get the information. What do I do if I have a problem? Who do I call? What is the protocol in place if there's an issue with this medication? And yeah, so those are the big questions. All right, so now moving on to just getting a sense of how do I find clinical trials. Probably the best source for clinical trials is this website called clinicaltrials.gov. It's put on by the National Institutes of Health. Any clinical trial that's going on in the US needs to be registered at clinicaltrials.gov. If you can see that on the screen, basically you can search and you can find a study. And again, you can look for studies that are recruiting patients or studies that are not yet recruiting, or you can just look at all studies. And then you can type in a disease or a condition. So in here you might put non-alcoholic fatty liver disease or primary biliary cholangitis or some other liver disease or other disease. And then you can say, okay, so I want to look for people that are studying this this illness, but specifically I'm looking for a specific medication that they're studying. And that's the pathway that you can follow. And then you may want to look just at trials that are in your country or in your area. And then you can search and it'll give you a readout of the various trials that are available to you. It's a little bit difficult. It's not the most patient-friendly website, but it's the most comprehensive. But there are other resources that are available that are a little bit more patient-friendly. This is something that I found off of the American Liver Foundation website. It's called antidote.me. I was very frustrated when I saw it because I built an app when I was a fellow that does just this, but it's a great idea. So it's basically through a series of yes or no questions. You can get information about what trials are available to you. And so, you initially enter a condition, you enter where you are, what your age is, if you're male or female, and then you search, and then it breaks through a variety of different questions. So for example, when I typed this in and I typed non-alcoholic fatty liver disease and my zip code and my age, it started off with, hey, do you have a diagnosis of non-alcoholic fatty liver disease? Yes. And then yes or no question. Then that reduced the number of trials. And then it asked me, do you have diabetes? And then again, that filtered out the trials. And so through really easy yes or no questions, you get a running list of the trials that are available to you. And at the right side of the screen, it'll say there you had 20 trials available, 9 trials available, 4 trials available. And at any point, you can click on that link and find out what trials are available. So it's a cool resource to try and find clinical trials. The other thing you can do, talk to your doctor, talk to a specialist. If your doctor doesn't know about clinical trials, look at different academic centers in your area that are nearby you. Very often their websites will also have information about the clinical trials that are available to you. Finally, this was kind of a comprehensive talk about clinical trials. A lot of this information is available at the NIH website, Clinical Trials in You. This is the link to that. And it basically kind of goes through a lot of things we talked about today, as well as some additional information that people may find helpful. If you don't want to listen to the whole webinar again, you can read through it. That is just about going to conclude my portion of the presentation, and happy to answer questions at the end.
Thank you very much, Dr. Janardhan. I would now like to introduce Jess Schnur. Jess is a full-time registered nurse, a TBC patient advocate and autoimmune hepatitis patient advocate, and a member of the American Liver Foundation's National Patient Advisory Committee. Jess, I will let you talk more about your experience as a patient advocate and being in a clinical trial.
Good afternoon, everybody. Like she said, my name is Jess Schnur. I am a registered nurse, and I was diagnosed with PBC in 2014, and then got the autoimmune hepatitis diagnosis about 2 years later. And I am from a rural area in Indiana, the southwest tip of the state. We do have gastroenterologists in our area. So when I got diagnosed, we had someone to talk to that knew PBC, but she was very quick to say, when it's time to go to a university facility, a transplant facility, I will send you that way. So I was able to get connected with a university facility within about a year after diagnosis. And through that facility, I was referred for my first clinical trial. And one of the things that I really liked is when they mentioned the clinical trial, my doctor at the university said it was this other doctor performing the trial. He was very complimentary of the doctor and explained what the trial was looking at, the medications, and then it was a no pressure. It wasn't a car salesman coming at you. They had the nurse that was helping run the clinical trial give me a call. We had a nice chat on the phone. She emailed me all of the consents that had exactly the risks, the benefits, the scheduling procedures. So I would know every year that I was going to be 3 hours away for procedures all day. And then there were 3 other times a year I was going for lab work. So I feel like they really gave me a lot of good information right off the bat for me to look through and digest. And then they brought me back about a month after that conversation and wanted to make sure I sat down with my family, I sat down with my doctors, and that everybody was in agreement that this was a good fit for me. So I don't feel like I was ever pressured into a clinical trial. They made it very patient friendly. And then I had to go through the process of getting testing and making sure my labs were appropriate for the trial. And it was, you check them 1 month, you check them 2 weeks later, make sure everything looks good. And then they said, okay, you're approved for the trial. Let's go over everything again. And if you'll sign consent, we're going to put you into the phase 3B trial for this new medication that's coming out for PBC. And for me, it was a non-negotiable. I knew I was going to do it. there was only one medication available for PBC, and it wasn't really working for me. So I knew I might as well jump in this trial and see what comes of it. It's going to be helping other people. It could potentially be helping me. And just sitting around and letting the disease do whatever to my body wasn't working for me. I wanted to be proactive for it. So we started the trial, and we knew it was either 50-50 if I was getting the placebo or not. But to be honest, it was nice having that medical care taken care of during the trial. Um, I was going to, like, again, I had to drive 3 hours away, but I was compensated for my drive time. But I was speaking actually to a hepatologist every 3 months. I had the research nurse. We emailed back and forth. She would call me weekly and check on me. So I really felt like somebody was listening to me about my disease. And I think some of us with these rare liver diseases have felt not heard before. And they validated everything and took into account my symptoms. And it really made me feel like, okay, I'm not imagining these things. And it made me feel accepted. So I really felt like my research doctor and research nurse is part of the family, and I still communicate with them to this day. In fact, my hepatologist moved, and my research coordinator actually took over my care. He asked for the privilege. I remember him saying that, can I take over your care, or would you prefer to go to someone else? So I feel like it really gave me a good foot in the door with an actual hepatologist, considering where I lived, that hepatologists are not there. So we started the trial, we did all the testing, and I think it was about a year and 6 months into the trial, the medication actually got pushed through the FDA and was available. And so then at that point, you're looking at, do I stay in the trial and we don't know if we're getting the medication, or the medication's available, do I need to jump on it? And my doctor was very frank, and he had told me from the beginning, if the medication becomes available, I'm going to recommend you drop out of that part of the trial and get on the medicine. I will not do anything or let you sit and not be helped when I know there is something out there that should work for you. So I appreciated that as well. They really cared about me. I wasn't just a number, even though everything's just labeled by numbers in a clinical trial. They really took it to heart and focused on me being okay and me getting better, and focused on the emotional aspect of things. So I really appreciated having them in my court for that. When the medication became available, like I said, he gave me the option to come out of the trial and start the medication. So that's what we did. But he was actually able to funnel me into another part of the trial, which is more along the research study phase, where people are on the medicine. Now we're going to check these labs every 3 months, do your EGD every year, and look ahead and see what is this medicine doing in the long-term effect. So I was still getting the benefits of the trial, but I was also getting the medication at that time. So I feel like my experience with the clinical trial was very good. I had access to healthcare that I didn't have access to. Granted, I had to make sure I had a place to stay when I drove 3 hours away, because normally we were up there for all day. But we were able to work that out with family and friends, and we were compensated for the trial. I can't speak to every trial if that happens for everybody, but that was nice on my side of it. And then I have made these relationships with these doctors and these research nurses, and they know they can come to me with new trials coming up. And we really bonded over all this research trial. And I'm out of the research trial right now, but he's always recommending me for other trials. And um, I think if our slides are almost the exact same, Dr. Janardhan and I, and if you go on to the NIH website, if you go on to antidote.me, you've got access to all of the different trials that are available. And it's best to read about them, then take the information to a doctor, to someone you trust, to look over it and make sure it's appropriate for you. I think if you're at a point where we knew with my disease process, I wasn't going to have to worry about having kids, and that was part of the trial. I had to sign a form saying I knew I wasn't going to be trying to get pregnant, But a lot of times, especially with liver disease and PBC, you're older as you're getting diagnosed. You might as well volunteer for a trial. See what happens. They're not going to do something to put the point of it is to make you worse. They're trying to do things to make you better and help people down the road. And that's why I really jumped on the trial process. And I recommend anybody that's listening to get online, look for trials in your area, and at least look at the process, talk to someone that does trials, and see if that's something you want to go forward with. Because I know I have lots of friends having kids and little nieces and nephews running around. I would want somebody to have been in a trial if they come up sick with a disease later on. So for me, there was really no option of not doing the trial. I'm going to do everything I can to help as many people as I can while I'm dealing with this disease. And I think that is pretty much everything I have. I am definitely open to questions. My life with my liver disease is an open book, so don't hesitate to ask anything. But in my opinion, I'm definitely pro clinical trial, and we're not going to get treatments. We're not going to get medications out there to help people, especially with rare diseases, if people don't join up or at least make the attempt to jump into these clinical trials.
Okay, thank you so much, Jess. Now we will read the questions that we have. So the first question is for Dr. Janardhan. After a study has been completed or terminated, how is a patient monitored for long-term effects of a research compound for which all effects are unknown?
That's an excellent question. In general, there is ongoing monitoring that can be anywhere from 1 year to 3 years to 5 years, depending on the clinical trial. Again, it's usually depending on how long you were on the medication for. And that is all predetermined prior to starting the clinical trial. That you will know, hey, after this trial is over, I still have to maintain my commitment. I still have to maybe potentially come in for visits even after the trial is concluded or my participation in the trial is concluded, so that you can get this idea of long-term safety. The other component of it is through phase 4 trials, right, where they're already improved, and so you're starting to learn more about side effects. But anyone that is in a clinical trial will need ongoing follow-up, and it varies by the trial in terms of how long that follow-up is. For example, I think there's a general rule that the staff that runs a clinical trial needs to maintain their clinical documentation for several years, just in case there's an issue that comes up moving forward, so we still have all the data. It's not like it's all expunged. But yeah, so there is ongoing monitoring that occurs, and the exact timing of that depends on the clinical trial, the exact timing and the exact nature of it.
Thank you. I just want to quickly say that, just a reminder, we're not answering any personal patient questions, but we will answer, of course, the overall questions and try to get to as many as possible. The next question is, when people participate in a trial, are they all starting at the beginning at phase 1, or do they start in varying phases, 2, 3, 4?
No, so before you start in a trial, you will know what phase that trial is particularly in. Generally, so for example, let's say you started off in phase 1. You're probably a healthy person that doesn't have the disease that the trial is studying. So you will, it's just kind of an altruistic thing. Maybe you get compensated and you participate in that trial, and then it's over. And of course, you'll still get monitoring and everything that you should afterwards, but you probably wouldn't get asked to be part of the phase 2 trial because you don't have the disease that they're studying. There's a chance if you're in a phase 2 trial that there may be a rollover, and you may potentially be eligible for a phase 3 trial, but maybe not. But you will know that what you're committing to is that phase, that one trial that you're a part of. So if you're in a phase 3 trial, that you'll know ahead of time that you're in a phase 3 trial, and you'll know the duration, the expected duration. But no, generally you don't follow it from phase 1 all the way through to phase 3 and 4. Generally, this can be several decades. There's at least a decade in terms of the total amount to go from phase 1 to phase 4. So that could be quite the time commitment to do that.
Thank you. Okay, the next question is about children. So how is it that, a child that's in a study varies from adults that are in studies? How are they monitored different? Is something, taken care of in the process differently?
A big part of it is on the front end. Now, I do not take care of kids, so I can't specifically talk about recruitment. But I do know that working with institutional review boards, there's a lot more precautions and safeguards put forth when you're talking about children, because they are obviously a vulnerable population. And a child providing informed consent versus or their parent providing informed consent is a very different picture than a fully functional adult doing it. So part of it is on the front end, where the safeguards are in place to make sure that you're careful with a vulnerable population. There is a process right now where we see that there's a paucity of trials in kids. There's a lot of childhood diseases that get understudied because everyone's so afraid to try their medication in children. And so then, that's not a good situation. There's actually a section of the NIH website that I alluded to earlier that talks about the importance of clinical trials and participation in clinical trials for children and for the elderly. Because remember, when I first set those inclusion criteria, one of the first things I said is that you're between ages 18 and 65 or 18 and 75. That's not an uncommon inclusion criterion. So it leaves out the kids and it leaves out some of the older patients that we have. But in general, it's all preset ahead of time. The informed consent obviously needs to be in a way so that a parent or guardian would be able to review and obviously and provide that consent. But that's probably the big thing. I think it's more in the front end. But again, I'm not a pediatrician. I don't treat kids, and I don't have any kids in any of my clinical trials, so I can't speak with firsthand knowledge.
Thank you. What are some of the common biomarkers of liver diseases? Are digital biomarkers being used in clinical trials for liver disease?
Was that digital markers?
Digital biomarkers, it says.
There are, a lot of things that are being used to assess liver disease. It's a kind of a long question, but very often the way that people diagnose a liver disease is just by looking at lab work. They're seeing a blood test that shows that some of the enzymes that are made by the liver are elevated in your blood, and that could be the first sign that something's abnormal in your liver. But that doesn't necessarily imply that you have a liver disease. It could be a medication that you're taking that's causing your liver to be a little bit abnormal. Or it could be that you had the flu, right? So anyone that's had a viral illness, your liver tests are completely wacky, but they gets better on their own. So it's important to know that just because your liver tests are abnormal doesn't mean you have some chronic liver disease that requires you to make that diagnosis. But there are other ways. So there are some people that will have liver disease without any abnormality of their liver tests. Now, a trained hepatologist usually can see patterns in the liver test that will tell you that make you raise your suspicion that there's something abnormal. But in general, all the numbers will fall within the normal ranges. So there are certain other tests, some things called elastography, where you can non-invasively measure the amount of scarring in a liver or the amount of chronic damage in the liver. I'm not exactly sure what you're alluding to when you talk about digital biomarkers. There are point of care tests that are now being developed to assess for whether you have signs of liver damage or not, meaning just like a finger stick. But those are still kind of more in development. But the big thing that I think that we look at is we look for clinical signs. So, do you have jaundice? Do you have physical exam findings concerning for liver disease? Do you have fluid in your belly? Or we look for abnormal lab tests. And then rarely the other thing that we will do is look at what is your risk for developing family liver disease. If it's non-alcoholic fatty liver disease, do you have diabetes and high cholesterol and things like that? If it's autoimmune disease, we'll look at, hey, what's your family history of autoimmune liver disease? So there's lots of ways that we can find liver disease, but I think that's usually the first few steps. It's just the lab testing.
Thank you. Do participants continue to take their regular medications while in a trial?
In general, they will review all the medications that you're on. If one of those medications is not allowed in the trial, very often they will say that you need to, in order to participate in the trial, you would need to discontinue that medication, and they would kind of say how long you need to be off that medication. They may say that, well, if you've ever been exposed to that in the past 2 years, you can't be a part of the trial. But again, especially for a phase 3 trial, we're trying to understand how these medications work in conjunction with other medications that are often used in these patients, right? The exception to that is if we know that one of the medications you're on can directly affect the liver disease we're studying, that is what we call a confounder, right? That is where we won't know if the reason your liver disease got better was because of that medication that you're on, or is it because of the intervention that we're giving you. And so that's the one thing, is that if it fundamentally affects the disease that you're being studying, sometimes you have to either not be on it, or at least on a steady dose of it. That's kind of the way it is. But in general, if the medication is not on the list of medications that is prohibited or is regulated, then yeah, you'd stay on all your medications.
Great, thank you. How can patients be sure a clinical trial is legitimate?
I think that you'd want to make sure that it's something that's registered on clinicaltrials.gov, which means it's registered with the FDA. And in terms of legitimate, that's a little bit of a loaded word. I mean, in terms of it being a good regimen, I would definitely, if you're worried about starting a medication or being in a clinical trial where we don't know anything about the efficacy, then I wouldn't be in a phase 2 trial. If you want to at least have some sense of where this trial is, then I would get yourself involved at the earliest at a phase 3 trial. The other thing that you can consider is that, hey, what else is known about this medication? So this might be the first time that this medication is used in this liver disease, but what do we know about what it was used in other liver diseases or in other diseases in general? What's the side effect profile in those other previous studies? And so that's kind of getting more at the knowing more about a medication other than what is known for this specific indication in phase 2, phase 3. But definitely you want to make sure that whatever clinical trial you're a part of, especially if it's a clinical trial, not just a clinical study, where it's just observational, if there's giving you an intervention, you want to make sure that that trial is registered.
Okay, thank you. That is all of our questions for today. Thank you again for your time, Dr. Janardhan and Jess. Thank you to Bristol Myers Squibb and CymaBay for supporting this webinar, and thank you for everyone for joining us today. With that, we will bring this webinar to a close. Thank you so much for participating.
Thanks, everyone.